Okay, so another common thing that we see in our clinic is shoulder pain when reaching overhead. One of the first things that we test for is how the joint is rotating. If you don't have adequate internal rotation of your shoulder joint, all of the musculature in the joints surrounding the area are going to be compensating. So this is kind of the first thing that we tackle. So I'm going to take Colin through an exercise called PAILS and rails, pulled from the functional range systems. If you're having trouble sitting upright in this seated position, I would suggest coming up into sitting on a pillow. And what he's going to do here is take himself into his passive end range of internal rotation of his shoulder joint. He's going to make sure his scapula is depressed, pulling down away from his ears. And he's going to hold this stretch for at least 1.5 minutes, ideally 2 minutes. And he's using this hand to gently pull himself into internal rotation. If you're feeling pain here, ease off of the angle. What you should be feeling is a good stretch in the shoulder capsule. After he's held this position for 1.5 minutes to 2 minutes, he's going to build tension in his body. He's going to irradiate. And at 10% effort, he's going to start driving his forearm out of the stretch. This hand is going to stop him. He's going to ramp that up to 20%, 40%. The rest of his body should be matching the contraction. 60% effort, 80, 100% effort of his safest pain-free effort for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Now 100% effort trying to take himself deeper into internal rotation without using the help of his hand, holding that max contraction for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Releasing the tension in his body, using his hand to hold him in his new passive end range. He's going to hold this for another 30 seconds, focusing on breathing, and then he's going to start his second round of PAILS and rails.